Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on the top 10 causes of cough. Coughing is common and annoying, but it can also be a sign of serious illness. So this is a really important topic that you need to know about. We're going to be covering the symptoms and treatments of 10 important causes of cough. Now, if you like content like this, be sure to subscribe and leave a comment down below letting me know any health topics that you'd like covered in future videos. In addition, if you have any questions, leave them below and I will answer all of them. Before we get started with cough, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having any symptoms or if you're coughing, make sure that you go to see your doctor. Now, let's get started with the top 10 causes of cough. Number 10, lung cancer. Lung cancer is not common, but it's an important diagnosis that we should look for if somebody is having a chronic cough. Coughing is a common symptom of lung cancer, but you will typically have other symptoms also, such as coughing up blood or having chronic symptoms of fevers, chills, night sweats, and unexplained weight loss. The treatments for lung cancer depend on the type of lung cancer and the staging, but the treatments may include surgery or chemotherapy or radiation or some combination of those. If you want to make sure that you don't get lung cancer, my best advice is don't smoke. People who use tobacco products are 20 times more likely to develop lung cancer compared to the general population. Number 9, heart failure. Heart failure is one of the most common reasons for an adult to be admitted to the hospital. In heart failure, the heart is unable to adequately pump blood throughout the body to meet the body's needs. This can cause fluid to build up in the lungs, and this can cause coughing and shortness of breath. You can experience chest pain and palpitations when you're suffering from heart failure. And in addition, fluid can build up in your legs, causing edema. The treatment for heart failure is to optimize your medicines, such as taking aspirin or other blood thinners to prevent heart attack and stroke, statins to prevent heart attack and stroke and clots, as well as medicines to optimize your heart and your blood pressure, medicines like beta blockers and ACE inhibitors. In addition, an important treatment for heart failure is using diuretics, such as furosemide, which is Lasix. This medicine can be given in pill form or an IV to remove fluid from your body rapidly so that your body doesn't get fluid overloaded from your heart failure. Number 8 is pneumonia. Infections are some of the most common causes of cough, and pneumonia is a very serious infection of the lungs, which can cause fevers and chills and coughing and chest tightness and shortness of breath. Many people with pneumonia require the hospital. The treatment of pneumonia includes IV fluids and medicines for pain and medicines to bring down the fever. Depending on what is causing the pneumonia, we may use antiviral medicine, such as Tamiflu, if influenza is causing the pneumonia, or Paxlovid or remdesivir, if the pneumonia is being caused by COVID. If there's concern that the pneumonia is caused by bacteria, then we will use antibiotics, such as doxycycline or azithromycin, or ceftriaxone, or vancomycin, or some combination of those antibiotics. Number 7, medicines. There are some medicines which can cause cough, and the most common medicines by far that can do this are ACE inhibitors, such as lisinopril or captopril. ACE inhibitors are great medicines to treat high blood pressure and to treat other medical problems. However, approximately 1 in 10 people who take ACE inhibitors like lisinopril may develop a chronic cough. So if you're on lisinopril and you have a cough that won't go away, it might be because of this medicine, in which case you should talk to your doctor about switching off of this medicine and being put on a different medicine. There are other medicines that can also cause cough, but not nearly as often as the ACE inhibitors. An example are the beta blockers, such as propranolol or atenolol, and in particular, they tend to cause more coughing in patients with asthma. Number 6, COPD, chronic obstructive pulmonary disease. COPD is a chronic lung disease that's characterized by a combination of emphysema and chronic bronchitis. Patients with COPD experience chronic recurring symptoms of coughing, wheezing, chest tightness, and feeling short of breath. The treatments for COPD include medicines that open up the airways to make it easier to breathe, anti-inflammatory medicines, antibiotics, and some patients, their COPD is so bad that they need to breathe supplemental oxygen. If you want to avoid getting COPD, do not smoke, because the vast majority of cases of COPD are caused by smoking. Number 5, environmental irritants. This is a broad category of substances which can cause coughing when they come into contact with your airways. And this includes smoke, such as from nearby fires, smog, such as what you'll breathe in if you live in a big city, occupational exposure to chemicals or to fumes, depending on the type of place that you work in, or cold air can often trigger coughing in some patients. Overall, the patients who get the worst coughing from these irritants are people who have asthma or COPD or acid reflux. When it comes to treatment, one of the best things to do is to prevent the exposure by wearing a mask. In addition, taking certain medicines like antihistamines, such as Claritin or Benadryl, can be helpful, or decongestants, such as Mucinex. Number 4, gastroesophageal reflux disease, also known as acid reflux, also known as GERD. This is a very common GI problem which can cause coughing. People who experience acid reflux can get a spectrum of symptoms. They may get upper abdominal pain, they might get pain in their chest, they might get irritation in their throat. They're clearing their throat a lot, like that. They might have coughing, they might have nausea. The symptoms tend to be triggered by eating a big meal or by eating any meal that raises the acid in the stomach. So things like alcohol, caffeine, carbonated beverages, spicy foods. These are all things that increase the acid in the stomach and increase the risk of developing acid reflux. In addition, the symptoms tend to be worse when you lie down. So a classic example is you have dinner, it's a spicy meal, and you have some alcohol to go with it. And right after you finish eating, you decide to lie down. And then minutes or hours after lying down, you develop a lot of those symptoms that we were talking about for acid reflux. Some people only get one of those symptoms. Some people might get all of those symptoms. But all things considered, acid reflux is one of the most common causes of coughing. The treatments for acid reflux are to do some lifestyle changes to prevent those things we talked about. So less alcohol, less caffeine, less carbonated beverages, less spicy foods. Try to avoid lying down right after you eat. So a good rule of thumb is whatever your bedtime is going to be, have a rule of no eating within 2 hours of when you're going to go to bed. That way you will not trigger the acid reflux symptoms. In addition, we have medicines that are very strong for this, and my favorite medicines for this are called proton pump inhibitors, or PPIs, and these include medicines like omeprazole or pantoprazole. You take these pills 30 minutes before a meal, and this will help to prevent the symptoms of acid reflux. Number 3, asthma. Asthma is a common cause of coughing in both children and adults. People with asthma have a hypersensitivity of the immune system, in particular as it relates to the airways. Patients with asthma experience chronic, recurring symptoms of cough, chest tightness, wheezing, and shortness of breath. And these symptoms can be triggered by various things, such as cold air, allergies, exercise, or infections. The most important treatments for asthma include medicines that open up the airways, such as inhalers, including albuterol, and we also use anti-inflammatory medicines such as prednisone. Number 2, postnasal drip. Postnasal drip is the sensation of mucus dripping down the back of the throat, and this can cause coughing as well as throat irritation and other symptoms. There are different causes of postnasal drip, including infections, allergies, acid reflux, irritants, and cold air. The treatment for postnasal drip will depend on what's causing it, but general helpful treatments include antihistamines such as Claritin and Flonase, which is a steroid spray that goes up the nose. And finally, the number 1 cause of cough, the common cold. Infections are the most common causes of cough, and the most common infection that causes coughing is the common cold. A cold can cause symptoms such as coughing and sore throat, fevers, chills, and fatigue. Overall, these symptoms do not tend to be as bad as other infections such as influenza or COVID or strep throat and pneumonia. The treatments for the common cold include staying hydrated, getting plenty of rest, and taking over-the-counter cold medicines such as Mucinex or Dayquil-Nyquil. The common cold is caused by a virus, such as rhinovirus or adenovirus, and because of that, antibiotics are not needed to treat the common cold. With all these causes of cough, how do you know when you should go and see your doctor? Well, seeing your doctor is never the wrong answer, but the times when I definitely want you to see your doctor are if your cough has lasted at least 2 weeks, if you're having coughing and feeling short of breath, if you're having coughing with fevers, if you're having coughing with unexplained weight loss, or if you're coughing up blood. If any of those things are happening, make sure that you see your doctor right away. That's it for today. Those were my top 10 causes of cough. Thank you for watching. Be sure to subscribe and leave a comment down below letting me know any health topics that you'd like covered in future videos and if you have any questions. Remember, these videos are for education purposes only, so if you're having a cough, make sure that you go and see your doctor. Bye-bye.